Welcome back to Ask Abundance. Today I'm joined by Rebecca Smith. Rebecca is a limitless practice grad who came aboard Team Abundance. She has a premium fee private pay practice in New Orleans and is great at helping abundance therapists imagine what's possible for them. All right, so here is today's question. I feel almost guilty saying this, but the more successful with my practice has gotten, the more boxed in I feel. I'm full, I'm busy, I should feel proud, but it also feels like I can't charge anything without risking my income or messing up what I've built. I keep thinking, well, this is what I wanted, and then immediately thinking, so why do I feel trapped? How do I know what to shift when success starts feeling more restrictive than freeing?
Oof.
Deep. All right. Before we answer, I want to thank Therapy Notes for sponsoring Ask Abundance. I've talked about them for years. You know their features by heart, but what really sets them apart is that they genuinely care about your experience. It's not just about troubleshooting, they actively implement user suggested features like therapy search, clinical outcome tracking, and their AI notes feature Therapy Fuel. Everyone at Therapy Notes believes in the product and wants you to love it too. Plus, they're independently owned, which means no venture capital and no pressure to prioritize investors over their customers. This independence allows them to keep their prices fair, to focus on innovation, and to prioritize customer experience. With over 100,000 therapists already on board, they've proven you don't have to compromise success for quality. If you're ready to see for yourself, try Therapy Notes free for 2 months with the code ABUNDANT at therapynotes.com. All right. And I should note this person said the more successful with quotation marks. So this is like it's all on paper successful, right?
Yeah.
And they're
Mhm.
feeling boxed in. So,
Golden handcuffs for sure.
yeah, absolutely. So, what's standing out to you with this?
Ugh, this one is so interesting because I feel like for this person, I really wonder if they can talk about this with anybody.
Yeah.
I'm sure I'm imagining they have these therapist friends who are like struggling.
Mm-hmm.
And so this problem is not kosher for their normal friend group
Yeah.
is one of my guesses. So I feel like they might feel really alone.
Yeah.
Um, and it's hard. I feel like I'm having the same questions they're having. Why do I feel trapped? What about this is making you feel trapped? And I feel like figuring out is it is it the niche? Is it the modality? Do I work couples versus individuals versus intensives? Is it the schedule? Is it little things like the cancellation policy or different policy things?
Mm-hmm.
There could be so many factors that even shifting a little bit might be more aligned, but they're like, I can't, it's set in stone. It's actually working. Don't touch it.
Yeah. Yeah. And I wonder too if this person might be neurodivergent, because
Oh,
I
yeah.
think about how important new experiences are for our ADHD buddies. And that novelty really helps keep people feeling like life is worth living. And
Hmm.
for somebody like me who really loves a routine and can tend towards the rigid, like I'm fine doing the same thing every day for like the rest of my life.
Yeah.
But that's not most people.
Hmm.
And so I might ask this person if there's some novel thing they can bring into their practice. Like you were talking about modalities, maybe they could run groups. Maybe it's a modality like a clinical modality that they could get into and nerd out on. Um, maybe it is a niche shift.
Hmm.
Maybe it's yeah, I mean like there are so many little tweaks that we can make or like new fun learning experiences we can have.
Hmm.
And I don't know, I just kind of have an intuitive sense with this person too. Um, do they feel trapped in their life or just in their practice? Um, I'm seeing this a lot with people talking about burnout and like their practice isn't so bad, but like just the combination of everything is burning outy, but we blame it all on our practices.
Yeah.
Like I feel like we project stuff onto our practices that are life stuff too. Um, so with this person, I would wonder, like, are you feeling trapped elsewhere? Are you having fun in your life?
Hmm.
Because if you have like the resilience that comes from having a really rich, full life, then I don't think, I don't know, not everybody agrees with me on this. That's fine. I don't think our jobs have to be the thing that fulfills our sense of self and being and everything.
Yeah.
Um,
I feel like when I so limitless my goal was to go off insurance and raise my rates. And in doing that, I massively decreased my caseload, which I went from 35 a week to 20 a week.
Hmm.
Holy moly, that was great. That was amazing. And for what it might sound like a duh now on the other end of the line, but other end of that story, but I feel like my practice in a really beautiful way is a very small part of my life now. Like I can like bop out. It's not just hours, it's like the heaviness of how much I'm thinking about and planning it and worrying about like, trying to set myself up for it versus like when the practice does work, like it's just sort of it feels really contained so that I can go do the fun stuff. And
Hmm.
so like kind of like what you're saying, like what is it like to pour like if they have a successful practice, whatever that those quotes mean, they've probably poured a lot of themselves into that practice to make it successful. What would it be like to pour into your hobbies or your family or your friends or sleep or
Yeah.
something, right? And does that alleviate the pressure on the practice?
Right. Yeah, I think it's a really good question for them to be asking.
Mhm.
Um, yeah.
I
And
think too, oh, go ahead.
no, you go, you go.
So I think too, the if they genuinely do want to shift something in their practice, I wonder if they can shift it in like a measured way. An example would be I still do want to see X number of individual run-of-the-mill clients a week, but I'm so curious about these intensives, or I'm so curious
Mhm.
about a group. What would it be like to just like shove the whatever the practice is now into like slightly less time, cut a few slots maybe, and then
Mhm.
have 1 day a week for like experimentation. So if you're like maybe they're bored and maybe they need some variety, you can add in variety without blowing everything up.
Yeah, absolutely. Yeah. I like that idea that like it's not all or nothing, right? Not
Yeah.
everything has to change. It might just
Yeah.
be like intensives. I think intensives are going to become an increasingly common big thing
Mhm.
going forward. I really think that there's a clear up and to the right trajectory for them. And so I like that example that that's something like it's a whole new way of delivering therapy to learn, which is exciting. It
Mhm.
feels really different to provide. It doesn't just feel like back to back therapy to provide an intensive. It has a different vibe that some people really, really love. So,
Mhm.
I think it's really worth looking into what are some creative, not blowy uppy things that you can do to make your practice feel fresh.
Yeah. And if your practice is successful because you are seeing 40 people a week,
Mhm.
the other way to be creative is to say, okay, if I were to decrease, how much marketing would I need to do to sustain a rate that could let me see 20 clients a week? Marketing feels so creative and so just it used to be just like session all day, right? And
Yeah.
now it's like, okay, I have 4 sessions and I also get to like write this blog post or like chat with my friends and network or
Mhm.
whatever it is. There's a lot more variety when you do charge a premium fee
Yeah.
because you need to be more creative in some of that marketing, and that's kind of freeing and exciting.
Yeah, absolutely. Ah, well, thank you, Rebecca. I
You're
appreciate you
welcome.
being here. And
Absolutely.
for people who heard this question and also feel like they feel similarly trapped in their practice, if you've got a full practice, limitless practice might be a good fit for you. I'm going to put a link for that in our in the show notes and in the caption, depending on where you're listening or watching. And we have a free worksheet for you today. I'll also put the link for that, and that is You're the CEO. So it helps you kind of like step into your big girl panties or your big boy boxer briefs. I don't know,
Something.
something or whatever you're wearing, and to kind of make some of the harder decisions in your practice and look at things a little bit differently. Yeah,
Absolutely. Yeah.
amazing. Well, thanks, Rebecca. I'll see you later.
You're welcome. Bye.